I'm the course director for Merit Institute of Life Saving Skill. So today I will demonstrate how to do a CPR with the use of AED. Now, CPR is the only technique which can be done by a non-medico, because the assumption is that no CPR, the wrong CPR is better than no CPR. Because we know that wrong CPR is better than no CPR. And this is the only technique which can be done by even non-medico. There is no degree required for doing a CPR. Now, what are the indications of doing CPR? The indications are mainly when somebody has got a cardiac arrest, has got a respiratory arrest, he has drowned, and he has got a foreign body in the respiratory tract. In these circumstances, we do CPR, which is cardiopulmonary resuscitation. And as the name indicates, the cardio is the heart and the pulmon is the lungs. So basically, these are the two organs we manipulate in CPR. And now with the advent of AED, the chances of survival are much more when we use AED along with the CPR. Now coming to what is the basis of CPR, why should we do CPR if somebody collapses like in a mall and around us we are just having a troll or stall in the market and somebody collapses, then why should we do CPR? And what is the basis of CPR? The basis of CPR is that whenever somebody collapses, then his heart stops. And by doing CPR, we are basically compressing his heart between the sternum, which is the breastbone, and the vertebrae, because the heart stopped and the delivery of the blood to the brain is stopped. And if we know that if the brain cells doesn't get oxygen supply for a period of 3 to 5 minutes, then they start dying. So just to keep them alive, we divert blood from the heart towards the brain by compressing the heart between the breastbone, that is the sternum bone, and the vertebra. And we do it at the rate of 100 per minute. We have to do 100 chest compression in a minute, and we have to count loud and be fast. And after 30 minutes of compression, we deliver to rescue breath. Now coming to the actual technique, how do we do it? Now suppose this is a person who has just collapsed in front of me, and the sequence of events are like you have to go by the acronym of DRS and CAB. D means like when you are trying to help somebody, there should not be any danger to the rescuer, to yourself, because then you won't be able to help the patient in the full measure. Then check his response, whether he is really collapsed, whether he has got really cardiac arrest or he is not breathing. So the second is the response. The third is the S, send for help. Dial some emergency helpline number so that they can reach with the adequate like AED instrument or other kind of help, ambulance, and can take the patient to the hospital. Now this, as I told you, this patient has collapsed, and I am going to start a CPR, a demo CPR for you. Hello? So after that, like I am just trying to activate him, but he is not responding. So next step is that I will check his breathing. You can check the breathing by putting your ear towards his mouth, and now he is not breathing. So immediately, not more than wasting 10 seconds, you will start the CPR. Now how do you do CPR? Basically, you have to keep the heel of your palm and the middle of the sternum, that is the breastbone, keep it, and lock your finger with your other hand, and lock your elbow also. This is very important. And by locking your finger and the elbow joint, then you compress the chest with your whole body weight and count at the rate of 100 per minute. And you have to compress the chest by 2 inch or 5 centimeter in adults and 4 centimeter in children. So you will start CPR by compressing the breastbone. So here we go. This is the heel of the palm. Keep in the middle of the breastbone. Interlock your finger, lock your elbow, and start counting. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 25, 26, 27, 28, 29, 30. Now after 30 compression, you will deliver 2 rescue breaths. Now no more mouth to mouth respiration is recommended. There is a device which is called as mouth connector, and that is used to deliver the rescue breath. So how do you deliver the rescue breath? You have to correct the airway of the patient, because sometimes the tongue can block the airway. So you have to extend the neck of the patient, presuming that he doesn't have a cervical spine injury, because sometimes the patient can collapse after falling from a height. So you have to correct the airway. Then you take this mask, and this is a teardrop mask basically, and this indicates the nose side. So you encircle his mouth towards the nose and make these two C shape with your hands, and encircle the mask, and with extended neck deliver the two rescue breath. So could you see the chest rise? There was chest rise. So after delivering the two rescue breath, again start the CPR. Again CPR. 1, 2, 3, 4, 5. So like that we do again 30 compression. Again we deliver two rescue breath. But like I asked him to call somebody for their help. And now we have. Can we have AED?
AED.
So fortunately we have AED machine, and this should be kept on the side where you are for the patient. Now this is the AED device, which is an automated external defibrillator, and it recognizes the rhythm of the patient, and if the rhythm of the patient is not alright, and if it requires shock therapy, then it will deliver the shock. And there are prompts which it tells you to follow all the prompts. So we will start using the AED. So there is a button, on off button. Press it.
Apply pads to patient's bare chest.
So we will apply the pads.
Place the pads connector next to flashing light.
Now connect with the
Press pads firmly to patient's bare chest. Analyzing heart rhythm.
So it's analyzing the heart rhythm.
Touch the patient.
Don't touch the patient, stay clear.
Shock advised. Charging.
Now it has advised shock and it is charging.
Clear of patient.
Stay clear because you should not get electrocuted, you should not get the shock.
Now.
Now it is recommended that we should deliver the shock by pressing this button.
Shock delivered.
Shock has been delivered.
Pause. Start CPR.
Again we will start the CPR like we started before. 2, 3, 4, 6, 7, 8, 9, 10. So again 30 compression followed by 2 rescue breath. So this is how we do CPR with the use of AED. And we have to complete 5 cycles before we reassess the patient. So this is the way we do CPR along with the use of AED. Okay, thank you very much.